I am Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. We are pleased to bring you the March issue of our journal with some great papers on venous and lymphatic diseases. You can download all papers we are presenting today free of charge. The Editor's Choice article this month is entitled Randomized Double-Blinded Study Comparing Medical Treatment versus Iliac Vein Stenting in Chronic Venous Disease. This is a significant contribution to the venous literature since this is the first randomized controlled double-blind trial that evaluates iliac vein stenting in chronic venous disease. The study was authored by Dr. Fabio Rossi and colleagues from Sao Paulo, Brazil, and from Phoenix, Arizona. 51 symptomatic patients with greater than 50% iliac vein obstruction on IVUS were randomized to best medical treatment alone or best medical treatment and iliac vein stenting using wall stents. Technical success and patient compliance were 100%. Median pain scores using the visual analog scale for pain improved significantly after stenting at 30, 90, and 180 days after treatment. Similarly, venous clinical severity score improved significantly after stenting at all time points. Primary assisted and secondary patency rates of the wall stents implanted into 26 patients were 92%, 96%, and 100% respectively. Finally, there was significant improvement in quality of life as measured with the 36-item short-form health survey, with improvement of the mean scores achieved in both the physical and the emotional domains. The authors concluded that based on these early results, iliac vein stenting with wall stents are recommended for symptomatic patients with greater than 50% iliac vein obstruction on IVUS to decrease symptoms and to improve quality of life. The next paper is our CME paper. This month you can earn Category 1 credit by reading this article on the hemodynamic effects of pregnancy on the lower extremity venous system. Now, this comprehensive review was authored by Dr. James Taylor and colleagues at Johns Hopkins Hospital and the Vein Center at Greater Baltimore Medical Center in Baltimore, Maryland. Pregnancy causes significant hemodynamic changes in the human body, with progressive decrease in arterial pressure and systemic vascular resistance, and an increase in the pregnant woman's heart rate and cardiac output. Coagulation changes are also significant in pregnancy, with increase in most procoagulant and some anticoagulant factors, and increase of the von Willebrand factor and some of the fibrinolytic proteins. This article reviews the risk of acute venous thromboembolism and primary and secondary chronic venous insufficiency related to pregnancy, and discusses current indications and results of non-pharmacologic and pharmacologic prevention and medical and interventional treatments of these conditions. It sets two important goals for further research. First, to look at the potential effectiveness and long-term safety profiles of the new oral anticoagulants in the mother and fetus. Second, to organize randomized controlled trials to investigate potential treatment strategies of varicose veins and more advanced forms of chronic venous insufficiency related to pregnancy. The next paper I'd like to introduce is on endovascular recanalization for non-malignant obstruction of the inferior vena cava. This is a single-center retrospective review authored by Drs. Erben, Bjarnason, and colleagues from Mayo Clinic in Rochester, Minnesota. This study analyzed complications and results of 66 endovascular inferior vena cava with iliac or iliofemoral reconstructions performed for extensive chronic non-malignant venous obstructions involving the inferior vena cava caused mostly by severe post-thrombotic disease not responding to prolonged medical management. The authors used wall stents and Gian Turco Z stents implanted through transjugular and transfemoral approach. Technical success was 90%, there was no mortality or clinically significant pulmonary embolism, and 3-year secondary patency of the stented veins was 92%, and symptoms relieved or improved in 83%. Mean VCSS score also improved significantly, and all 20 patients with active venous ulcer healed their ulcers at a mean of 79 months, and there were only 2 ulcer recurrences. The authors concluded that endovascular recanalization for non-malignant symptomatic inferior vena cava and associated iliofemoral venous obstruction using balloon angioplasty and self-expanding stents are technically challenging. However, they are safe and durable, and venous stenting in these patients should be attempted before open surgical reconstruction is contemplated. The final paper we would like to introduce you is entitled Complication and Retrieval Characteristics of Select Platinum Filters, authored by Brian Lee and colleagues from Cedars-Sinai Medical Center in Los Angeles, California. Now, this is a single-center retrospective study of 556 patients who received the Select Platinum filters. 335 patients, 60% of the cohort, had computed tomography or venography follow-up at a median of 45 or to 90 days. Complications of the filter placement included inferior vena cava perforation greater than 3 mm in 19.4%, new filter thrombus in 8.7%, filter migration greater than 2 centimeters in 0.3%, and inferior vena cava thrombosis in 3.3%. Retrieval was successful in 155 of 155 patients. These authors concluded that complication rates of Select Platinum filter at 3 months were low and similar to previously reported data of first-generation Select filters. The study also confirmed that a high retrieval rate with these filters is possible. Now, these were just a few of the many outstanding articles from our March issue. To access these articles free this month, please download them on www.jvsvenous.org. Enjoy reading all JVS journals and let us know any comments or suggestions. See you next time for the highlights of the May issue of the JVS Venous and Lymphatic Disorders.